Hi, I'm Dr. Paul Conrad from Quincy Medical Group, and we're here today to talk about thyroid radiofrequency. Thyroid radiofrequency is a treatment that passes radiofrequency waves through your tissue from the probe to the grounding pad. While that's happening, the tissue inside where the probe is actually being baked. The tissue is destroyed by cells in your body that would basically resorb the tissue over time, shrinking the nodule and then making some of your symptoms disappear. This is a relatively new technique that's being done here in the United States, but it has been done in Korea and in South America for up to 20 years at this point. So who are the patients that qualify for this procedure? Patients that have a visible nodule, people that are having trouble swallowing because of their nodule size. Also, if your nodule is growing and you have just been monitored for this and you want to have something done about it. And also people that have a hot nodule, which is where the thyroid is over-functioning, can have this done provided it's just a single nodule. This treatment is available for patients that have had benign thyroid nodules for years or just recently developed. You have to have a benign biopsy twice in order to qualify for this procedure. The benefits of the procedure are that it is scarless. It can be done in the office. You can get back to work much quicker. There are decreased risks because of the fact that we are not taking the gland out, we are actually burning it from the inside. So the risks to your nerves that control your voice, as well as the parathyroid glands, which control your calcium mechanism, are at lower risk. Also, because we're leaving some of your normal thyroid tissue there, you won't have to take medication. This is more likely if you've had your thyroid gland removed that you would have to take medication for the rest of your life. The overall shrinkage rate of the nodule over a year is about 80% decrease in volume and up to 90% in 3 years. The cons of the procedure are the fact that you may have to have multiple procedures done if you have a very large nodule, but the benefits also on that, if your nodule is crawling down into your chest, we can actually shrink it and pull it up, as opposed to having to have a surgery where they would have to go down in your chest next to some of the large vessels. How do you get a hold of us if you want to talk more about this? You can call our office at 217-222-6550, extension 6900. We like to offer procedures like this at QMG because it is cutting edge and it's relatively new technology, at least here in the United States. Also, it's good for patient care. It gets patients back to work faster and functioning faster, as well as I think your overall experience would be much better if you had this done sometimes as opposed to surgery.